Pakistan, spending your precious time here. And thank you, Danish, for our co-chairs for Apna Merit, who has assigned me and Atiya lead on research for merit. And thank you, Nahid. I don't know she's here. Nahid Usmani, Apna president. And our new coming president next year, Rizwan Khalid, he's also invited. He may be here. With that, I think I'll let Atiya get started and then it'll come back to me, Atiya. Atiya is a MD, PhD, a researcher in skin cancer, and I'll let her get started.
Okay, thank you, Dr. Rao. Assalamu alaikum, everyone, and good morning, USA, and good evening, Pakistan. My name is Atiya Harun, and this is my first formal APNA webinar, and I'm very excited to be here. I will start with my own brief introduction, as Dr. Rao already mentioned. I'm MD PhD. I did my MBBS from Rawalpindi Medical College, and then I did my PhD from University of Ryukyus, Okinawa, Japan, in Innovative Diagnostics Medicine. Currently, I'm working as a resident physician dermatologist at Robert Wood Johnson Medical School. I'll be your moderator today. So this is our agenda. We will start with my introduction and Dr. Rao's research interest, followed by brief introduction by each panelist. After that, I will let each panelist comment on the following questions. 1, 2, and 3 questions. I will talk more about those questions when we come to that point. And then it will be followed by goals for the next meeting and closure remarks by Dr. Rao. So my research interest, I'll just briefly talk about that, specifically skin cancer, more like melanoma right now. I have been working on in vivo and ex vivo microscopy for the last 5 years with Dr. Rao. And we have currently updated it to next level by incorporating artificial intelligence to ex vivo and in vivo confocal microscopy. This is couple of my papers from last few years. I started research work after my graduation from RMC in 2010, and I'm currently actively working in skin and, as I said, in vivo and ex vivo microscopy. And you can see that my highest number of publications on the chart on the left side is when I started working with Dr. Rao, obviously in 2015-16. So I'll let Dr. Rao talk about his research interest now.
So actually similar research is research in our lab, whoever is working with the skin cancer. And in skin cancer, basically we are into diagnosing skin cancer early by various non-invasive methods. We call them in vivo or ex vivo microscopy. And we are actually the kind of leader in the United States in confocal microscopy, our team, me, Atiya, and all of us. And then we have several IRB approved studies in that zone. And then also like Danish, we are involved in some clinical trials in biologics and some other stuff. I don't know, Atiya pulled this up, but it looked like most of my publications are in that area, which I'm mentioning in diagnostics. But sometimes, you know, obviously we publish other diet related and dermatology related things, but this is where most of the recent publications are. Now, also our work, especially this non-invasive work, has resulted in 2 books by me or by us. One is a hardcover book, one is a digital book, and then we also recently published a textbook of dermatology, which is on the right, which is 2 volumes, and it's a basic test book which people follow for their education during residency and post-residency. Then Atiya, I want you to go back and explain what are we trying to do. But before we get started, really Danish and Shahid and my idea is in no way to basically challenge whatever research was going on in Pakistan. Our idea is to see whatever is going on, how can we improve and how much can we help and just collaborate and move this thing forward. So Atiya has done some just basic research. She's gonna talk about that. Yes, Atiya.
So as you can already tell, I'm very excited about research. That's why I ended up doing PhD. But my research idea is basically to keep things simple and then get the ideas how like where we are right now. So when Dr. Rao told me about this webinar, I didn't have enough time to collect all the data from Pakistan. So I wanted to know if I'm sitting here in New Hampshire and I want to see where our current healthcare research is in Pakistan, what's my like most convenient way is. So I went to PubMed and I start typing some words, and I used one or two keywords. I started with obviously Pakistan. I typed in Pakistan in the PubMed, and if you see, PubMed has updated a new way of showing the results. It's on the left side, there is a graph. It shows that we started in 1947, obviously, and it's going up to 2021. And most of our publications in Pakistan is around, I think, after, I would say around 1980 or somewhere around that. And then it's constantly increasing. So that's a very good graph to first thing to look at. And the total number of publications, which according to PubMed is like 54,000. So this is just to get a start idea what's going on right now in the PubMed, and when we type the keyword Pakistan. So then I typed Pakistan and medicine, and it ended up showing that first paper maybe started back in 1948, and it's still going on, it's still rising. The graph is rising, and their total number of publications according to PubMed is 14,000, around 14,000. Then I typed Pakistan and surgery, and it ended up showing 6,000 papers, a huge contrast from medicine, but also starting in 1951. The contrast didn't stop there. There is a huge contrast when I type, obviously, dermatology, my interest. So Pakistan dermatology, when I typed that, it started in 1956, a little bit late, and then it ended up showing only 367 results. So that was little kind of like shocking for me that it's a huge difference in number of publications or the research going on. Out of interest, I also typed in Rawalpindi Medical University, Pakistan. It showed 2000, which is I understand because it was Rawalpindi Medical College before, and there are other factors involved in this as well. But it ended up showing that it started in 2000, and still current research is going on. And highest number of publications were in 2019, which I think is great. The graph is really high in 2019, and it's still going on. And the total number were 812. So then I wanted to see how much their total number of index journals in Pakistan. This data I got from from the internet, but according to that, their total number of index journal are 79, which is I think is really great. So that's it. That's what I found from my research in last week when we started to do this webinar. Please update.
And this slide we actually stole from Danish's previous lecture. Mm-hmm. And it is very relevant. Why the hell we even want to do the research? And you know, if it reads, if we teach today's student as if we taught yesterday, then we basically rob them of their tomorrow. So, you know, that's why research is important. And by research, we don't mean that we have to discover something molecular or DNA. Research could be education, you know, related. It could be related to diabetes. It could be related to mental health issue or COVID or whatever. But research being to do your work better for tomorrow. So with that, I think, Atiya, we would start inviting panelists one by one. Yes. Before we go into that, I think, Shahid, I'll ask our chair for merit, Shahid, and then Danish, if they want to add a few words.
Thank you, Danish. Thank you, Babar. I've used Danish because he's always with me. But Babar, it's a great program that you have started, and we wanted to do it for a long time, and you as a chair have done this kind of work in merit before, but somehow we could not get the momentum and keep it going. So I think the time is right now that with your team, who is very active, Atiya, I know we talked about it 2 years ago, but I think the time is right. There are other committees in merit who are doing great work and are interested in research in their own field. For example, Avaz in nephrology, or Dr. Kabani in critical care and nursing issues, and you know, cardiology and other fields. So in stroke, we have started a 4-hospital data collection about the stroke care in Pakistan in Rawalpindi, Islamabad region with PIMS, DHQ, Fauji Foundation, and POF Hospital WA. So that is that was approved actually last year by RMU, IRB, but we have to get approval. We started anew this time, and we have an international registry sits for it. So there are some work going under merit in different, Danish is doing in movement disorder, many projects in Pakistan and here. So, but I think the necessity is to take it as a project of its own, like Babar you have taken. So I think to really take it to the next level, research should be focused as a committee of its own, so that you can supervise or coordinate with different people who are doing their work. And I think this is a great starting point that great leaders, from NIH, our guest of honor, Dr. Ikram is here, and other like Dr. Mustapha Qadri, I know, and Dr. Mubin Iqbal, great researchers, great people. So I think this is high time we collaborate with them and learn from them. And I would invite Danish to add something.
Danish.
I think one thing that I wanted to highlight as we go into discussions on the 3 questions that are very wisely chosen by the Dr. Rao and his team, is the effectiveness or impact of research. We need to have very clear on that. Dr. Haroon pointed out one way of measuring the impact, which I personally consider a level 1 for a national impact, which is the number of publications. But I think a higher level goes on to measuring some form of a impact score or index score. And there are 2 that are often used. One is the impact factor of a journal that is multiplied by your place in the authorship. And the other one that is actually more easily available, because impact factor is a secret formula and is not publicly available, how that's calculated, and I think is gradually dropping. And more recently, the Sky Journal ranking by Scopus is taking its place, which is the H index. And then there is a new factor that is coming out, which is a calculation of social media impact along with the H index and impact factor as a composite score. But the point is that the quality of publication and the journal that it's published in is more than just the number of publications. That will be the level 2. But I think what we really need to see with General Amir Ikram present here is the level 3 of research effectiveness, which is the financial impact on the researchers, on the country, on the institutes or universities. And there are various ways to measure it. I think the easiest way, which is an indirect way to measure, is the funding or grants that are earned by a university or the country as a whole. They are given based on your reputation of research. So the more research effectiveness you do, the more your reputation build and more money you can bring in. The other ways will be looking at patents. How many patents have been registered by an institute or the country as a whole? And then one other way, which is the real way, but is the hardest one to calculate, is the impact on GDP of a country, the gross domestic product, which is the productivity. Is this research really making an impact? So for example, are you developing new concepts, new ideas? And those ideas doesn't have to be physical product. Those ideas could be an algorithm that you can sell. For example, recently in stroke, there was this computer software that was built to analyze the CT scan or acute stroke reliably so that you can decide if you're going to give TPA or not give TPA. And that university is now licensing that software for $12,000 a month to a single center. So imagine thousands of centers buying that software and then building it. Now you could build a new software that does the same thing. And if you can validate with the research, now you have a productivity. Now you can sell that software and earn a lot of money, which eventually is the goal of research, right? Research is making lives better, and lives are, when you're making lives better, you're rewarded financially as a recognition that you have done something useful. So I think we should keep these kind of levels in mind as we discuss on the questions posed by Dr. Rao. Thank you.
Thank you, Danish. We just posed these few basic questions just to get a discussion started. But the idea is, as we move forward, we will include all those, and obviously Danish will be on the team because he is very aware of these things. So I think with that, Atiya, let's have Dr. Amir Ikram started. Amir is, as he said, last time we actually talked was like somewhere after I was in medical college and he was doing FAFSC in the neighborhood in Pindi. And next time I know he's a director of NIH. Amir, please get started.
Thank you so much. Thank you so much. First of all, a little bit of in my introduction, I graduated from Army Medical College and did my fellowship and PhD in microbiology. Been almost, Allah blessed me to be to most of the universities abroad as well. I do hold fellowship from UK and did a good number of courses from US as well. Currently, I am doing as the Executive Director of National Institute of Health. Also looked after the Pakistan Health Research Council for a short time. And then I've been looking after the T vertical program, TB, AIDS and malaria. These are the areas definitely which need a lot of research in our own country. In my personal capacity, I've been working with Fogarty International, NIH, US for quite a long time. It's more than a decade, and done a good number of projects with them. Then with National Academies of Sciences of US, and we did come up with a book as well. And similarly, CDC and so many other US and other country institutes. Now, once I joined, we tried to change the culture of this National Institute of Health. And alhamdulillah, we have been quite successful. Your president especially came to see me at NIH, and we were fortunate to have her over there as well. And this is the best time to pull up the research. The worst part that I truly believe is the response from our side once dedicated and passionate people like you want to come back to Pakistan or getting back to Pakistan and having certain relation and moving on with the research project. We have tried to fill up this gap, fortunately, and maybe we'll definitely look forward toward your side now, towards APNA, that how you join us for different things. Right now, alhamdulillah, good number of international grants. Recently, I got a $2 million grant from Gates Foundation as well, and this is just one that I'm letting you know. There are a multitude of other things, and it's all based upon basically the passion, the dedication, and transparency, and the timely delivery of the objectives. We do get so many administrative grants now, and then a multitude of other countries and institutions they want to join NIH. We do have a team now which look after Dr. Amna. She's right there in this webinar, and we look forward where we join hands. I mean, with the Canadian group already, we have submitted the first grant, and much more to come, inshallah, in the near future. One thing is the assurance and guarantee and actual performance. In very briefly, unfortunately, we lack in the clinical and medical research badly. It's the number of publications. Unfortunately, mostly talk about the statistic data, making it a little bit meaningful. But the true cell, I'm not talking in particular, as you already pointed out, going down to the molecular level and all that. But what we are lacking are the total clinical trials. If you go to the FDA site, you find just 300 or more validated trials in Pakistan. So these are the areas we would be targeting. We are trying to establish the first ever biobank within NIH, and we have plenty of other facilities. We are trying to rejuvenate through NIH, and hopefully, inshallah, new legislation coming up. The Health Research Council would also be coming under National Institute of Health. This will definitely provide the platform for elevating the standards of medical and clinical research. And the best passion would be this clinical trials in Pakistan, which we understand otherwise is $1 billion industry. And why are we lacking behind? We know the reasons. And I look forward towards all of you that if we join hands together, because right now I'm also in my current capacity and my own efforts, I am chairing some of the WHO committees as well, and multitude of other portfolios. I'm also co-chairing with Dr. Zulfikar Bhutta the committee for HEC research. And I think with the new chairman at HEC and a very enthusiastic DG, the things are transforming. Just to give you an example, for COVID, there are grants which have been rapidly disseminated, and I mean, we are the best is, I think, involvement from your side, your academic institutes, taking into loop, joining hand, putting these research grants, whether it comes to HEC, whether, because my observation as I've been serving as focal point for more than a decade for the National Universities Program with HEC is that 95, more than 95% grants are taken away by the non-clinical sites. And unfortunately, we need to train our people for taking care of the grants, for writing the grants, and then in research methodology, and then moving on. And private practice may be one of the reasons, but I think it's still time has come when we need to inculcate. Even during this COVID crisis, we have submitted a huge number of grants at the international level. We have been successful in getting the grants, and now is the time again that we join hands together with very capable people like you sitting abroad and who want to do something for the country. So this is just a brief. Over to you, Baba. Thank you so much for making me join this thing. Thank you.
Thank you, Amir. Thank you. That was actually a very good summary. Obviously, we'll have a lot of questions and your guidance as we move forward with you in this project. So I think
next is on panel is Dr. Mustapha Qadri.
Dr. Mustapha Qadri, please say few things what you have to say.
Action about you.
Maybe he's muted, Dr. Mustapha.
Dr. Qadri, you are muted. Yes.
Okay. Assalamu alaikum, everyone. Bismillah ar-Rahman ar-Rahim. Thank you so much to Apna Merit for inviting us to be part of this panel. So my background briefly, I'm a Dow graduate and did my residency in internal medicine at Wright State University, Dayton, Ohio, followed by Pittsburgh, assistant professorship there. Then half my time has been spent in Saudi Arabia and half in Pakistan. And my love for clinical research is relatively new. It's only about 17 to 18 years old after having spent quite a lot of time doing clinical nephrology and clinical medicine and going into education, and realized that this tripod of service, education, and research has to be really put together. And the clinician research education is a very major area and major gap in Pakistan. So one of those things that we embarked upon earlier on was to try and bring an evidence-based healthcare movement to Pakistan through Gordon Guyatt, getting him and out here and doing a couple of workshops, getting that orientation and critical appraisal of literature amongst the clinicians and medical students and residents. And subsequently, over the last decade or so, my main focus has been in trying to mainly try and fill in this gap that General Ikram pointed out in clinical research through clinical research education. We have, in the last 6 years at different places like Shifa and then NUMS, National University of Medical Sciences, where I serves as the inaugural Dean for Research and Academic Development, and also now at Maroof as Chair Research. Our focus has been in trying to get this NIH Introduction to Principles and Practice of Clinical Research Education transmitted to a variety from medical students, clinicians, nurses, pharmacists, allied health professionals. And we've so far trained about 450 professionals in the last 6 years through different courses, including one which is currently ongoing on Zoom at this point in time. So our main focus, which I pointed out to the Ministry of Science and Technology, where I was appointed as the Standing Committee for Clinical Trial Chair in April. That committee met a few times with representatives from DRAP, and we put together 3 or 4 projects for Pakistan. One was to try and put together a clinical research training institute. Second one was an NIH-style clinical research hospital, like a 250-bed hospital. Third one was a network of clinical trial centers in the country. And unfortunately, like everything else, that fell a victim to COVID and a lot of other political reasons, it's sidetracked a bit. But our main passion is to try and put together good, valid research education so that we can do scientifically valid, internally valid studies which translate some of the work being done in the basic science labs and some of the work being done in the epidemiological and public health arena to try and bridge that gap. And the clinical research education to me is one of the major areas we need to focus in, and I'm happy to contribute and collaborate within the country and with you guys on this issue subsequently. Thank you so much.
Thank you. Thank you, Dr. Qadri, so much. Atia, who's
next on the list is Dr. Umar.
Dr. Umar, who's our Vice Chancellor for RMU. Dr. Umar, you're on.
Dr. Umar, you are muted.
Unmute, please.
Yes.
Yeah.
Can you hear me?
Yes. Yes, we can.
Okay, thank you very much. So, a very warm welcome, everybody, and thank you very much for the invitation. So, what I was talk is National Research Policy Framework. Babar, actually, being a senior healthcare professional and Vice Chancellor of the university, I couldn't find a single site where I could find the national research policy framework. So unfortunately, to my knowledge, maybe limited, other people know this, there is nothing like a national research policy framework. If I start from the top, and how does it work? What is the budget? Where is the office where we can find all this? What is the team which is doing this? What is the legislative support for this? So unfortunately, if we do not have a national research policy framework, I see the same result I have seen in the past. Then coming back to the next hierarchy, the federal government. If I talk of the Pakistan Health Research Council, I think this is about a 35-year-old institute. So I'm not sure if you go to the website, you can see, what is the sort of, unfortunately, of using this word, the poor performance. Then come to the, other institutions like DRAB, where you can get registered for the clinical trials. And I'm not sure many people even are aware of the name of the DRAB, even the universities or the medical colleges, the healthcare professional. Coming vertically down to the provincial health research. There is nothing like provincial health research councils. There is nothing like any department of research in the Department of Health or Education in general. Then coming further to the Higher Education Commission. The network is with the universities, but the Department of ORIX, the most weakest department in the university is the ORIC and entrepreneurship. So if you have the weakest department in the university, which is ORIC, you can have a lot of difficulty putting the research at grassroots levels. Now I come to the third part of my comment, where it should start. Universities, you are well aware our university is just 3-year-old and still struggling for the simple budget for HR. Then the College of Physician Surgeons, you are well aware that you are right, a dissertation, and which is just reviewing the literatures. Coming to the medical colleges, which are the nurseries for the medical education, and this is where you learn the research. And everybody is aware of the curriculum, the conventional curriculum, which is not having a simple module of the research in 5 years. And you are mere trained like this, and still curriculum is like this, which is 40 year before. Whatever workshop you hold, what sort of certificate you do, whatever dissertation you ask, but if you do not have even research base at the medical colleges, in 5 years you don't train people or students for the research, the basic things about the research, then you can see the outcomes. Then coming to the, Rawalpindi Medical University, then what is the solution we have found? So solution is 8-step model of RMU. So what we have to do is first, the university must design the research curriculum for the undergraduate, the university residents, and the faculty. If you do not have a research curriculum, obviously, then you have a lot of difficulty in doing teaching methodology and the research, assessments, quality assurance, and publication. Then coming to the research faculty, look at the medical colleges and the medical university. You doesn't have even the chair for the research professor. you do not have assistant professor, you do not have the post of research resident. If you do not have a faculty, how are you going to teach first the research at the undergraduate and postgraduate level and faculty levels? Then coming to the clinical research, where is the lab you will do the clinical research? In any of the 19 public medical college and 23 private medical colleges and 6 medical university and whole of the Pakistan, is there any clinical research lab where you can do the clinical research? The answer is no, particularly in view of the even universities. So we are establishing the first research lab with 1.5 million rupees, 1.5 billion rupees. Then the research training. Qadri Sahab is doing a wonderful job. We have done dozens of workshops. Now we are doing the health research certificate course for 6 months. But that's not the solution. Is there a person who is just PhD in research? Very few. Is there a master program in the research? Is there a diploma program in the research? If you are not preparing the HR for the research, how can then you inculcate the culture of research? After even putting the people in laboratory, they are expert in gastroenterology, dermatology, but there is no faculty and research source for the HR training. So universities, our university have started this first program. Then the research publication, where you publish the research. So there should be a mechanism where the undergraduate can publish research, student can publish the research, and faculty can research publish the research. The Rawalpindi Medical University is the first university which have started the student research channel, where the low impact research can be published. Then we have started the resident research journals. We have 600 residents where they should publish their research. So they can't at the faculty levels because the research may not that high. So now we have 3 journals. One is the students, other is the resident, and third is for the faculty. And this is how to establish the research network and training at grassroots level. And this will then ultimately come up with the research programs in the country. Then the research presentation. So there should be mechanism that every resident, student, and faculty member is bound to present research, and institution must hold conference at institution level, national and international level, as the RMU is doing from last 3 years, and you are witness to this. Then the research directory. There should be the national research directories. I'm not sure how this mechanism can work. Then you can have a provincial, then you can have the health research council directory, then you can have the institutional, as we have one, you have already the part of that. Then come to the collaborative research and national research program, collaboration with WHO, CDC, as General Ikram has been mentioning. So I think we should be very honest. First work on this whole research network and the research national policy framework. And then this trickle down to the provinces and institutional and the university levels. And then it trained the human resources, faculty, then create the career for these guys. So this is the way forward, I believe, the research in Pakistan. Thank you very much for giving me this opportunity to share my ideas.
Thank you, Umar. As one of the, I'm looking at the questions also as one of the person attending the webinar, Mariam. She writes, would you realize that clinical research is not streamlined in Pakistan, but it's the role of the universities who will establish research, not the ministries, etc., which I agree. And Umar obviously is working hard to get these things done. But the idea is to get information today and then maybe move forward in a cohesive way. Who's next, Atya?
Before I move on to the next panelist, there are 2 queries. I know I have question answers. Then once we discuss about all these questions and after panelist introduction, we will address all the questions. That's one. I'm keeping a track of questions. Second, there are some, I just received a call. There are some people who are not able to see active speaker. I am able to see every active speaker. If you're not,
I
please.
think you are sharing the screen with your slide. Maybe if you remove that, they will see.
Okay, so I'm just gonna remove that.
Yeah, just remove that, then they'll be okay. Yeah.
Yeah, and I just
That'll
want
be
to
okay.
let you know that I'm keeping a track of questions. Once everything is done, we will ask all the questions. So next panelist on the list is Professor Mobeen Iqbal.
Much to Apna Merit and all the colleagues, Dr. Rao, Danish, and Dr. Shahid. It is really great to be part of this panel. Briefly about myself, as I was talking earlier, I did my residency training at East Tennessee State University and did my fellowship at Long Island Jewish, and came back to Pakistan in 2000, spent some time in Saudi Arabia. And during the process, I was involved in a different kind of research, different streams of research, in fact. So whenever, in US, primarily focus was around sepsis and bench site research, and from bench to clinical research. And then when I moved to Pakistan, turned out that a lot of things which Professor Umar very nicely described made me realize that probably high quality clinical research, as Danish was very rightly mentioning, not the number, it has to be the quality, was not very easy. So I kind of evolved towards educational research. So though my clinical stream kept on working, but more towards educational research at Shifa College of Medicine. Subsequently, I was chair of research at Shifa International and currently at Maroof. Now, throughout these years, my focus has been, besides educational research, implementation research. As Dr. Qadri was mentioning, a lot of time we have spent together in Pakistan and Saudi Arabia. Focus has been on capacity building in terms of analyzing research, and evidence-based medicine movement started in the 90s, and we were able to kind of get hold of Gordon Guyatt, who has been here in Pakistan a few times. So that really motivated, and that was one of my projects when I did my fellowship at ECFMG, Philadelphia in 2006 probably. And since then, I have been working at undergrad level. I think Pakistan, Shifa was the first med school where we had a proper undergrad curriculum on evidence-based medicine, which was integrated along with the community-based research. So that's what I've been doing. And I'm very much interested in something which I call continuum or research from undergrad to postgrad to faculty level research, where all these three areas of our professional life are very nicely integrated, so that there are mentors available, and that mentorship can be at peer level and at faculty level. So and also did some review on research, as Athiya was mentioning, but I use kind of different filters yesterday, and I maybe if there is a time, I can show you some of my research findings from PubMed, and that kind of had some interesting observations. So we'll discuss those once we'll move on. So I really thank you all.
We'll come back to it as toward the end. So Athiya, who's next?
Next on the list is, give me 1 second, Professor Khalda Zaki. We can't hear you, Dr.
Khalda, unmute yourself, please.
Please unmute. You can mute.
And Athiya, add one more person. My friend, a big time professor from Qatar is here, Waqar. We're going to have his comments towards the end.
Okay.
Assalamu alaikum.
Yes.
Can you hear me now?
Yes, we can.
Okay. It's an honor for me to be part of the Apna Merit team. Thank you so much, Dr. Shahid Rafiq and Dr. Danish Bhatti, for this honor. Also, Dr. Baba Rao, thank you for arranging this panel. I am a professor of sociology, and I specialize in social demography and community studies. My expertise are in the area of studying dynamics of population, fertility, mortality, population change, family planning, contraceptive use, maternal and child health. In my teaching and research, I have adopted interdisciplinary perspective, and particularly with the global interests, because it keeps changing. My educational background is in economics and demography. I have master's degree in economics and a PhD in sociology, and with a lot of training programs in family planning and health education. While I have spent a good deal of 35 years at Michigan State University studying, teaching, researching, and community outreach, I had wonderful opportunities to stay connected with Pakistan also. I've collaborated with few universities there, and in most recently as a Fulbright senior specialist, I've delivered faculty capacity building programs in developing curriculums, writing research proposals, and cultural competency in healthcare delivery. I am really excited about the Apna Merit and Pakistan collaborative initiative. I feel that it is a very timely initiative in a very untimely manner of pandemic era. My interest developed because I was already interested as a social demographer in the health issues and population issues, youth issues in Pakistan. But more recently, as I mentioned, through my faculty development programs in Pakistan, I reviewed dissertations as external reviewer, and I found a lot of gaps in their research process. The research proposals and research design did not coordinate very well. So students did not really were getting the answers to the question they raised in that research to begin with. So the whole inconsistency of concepts and operations and methodology were really very defective. So we need to work on that, and that's what brought me to delivering writing research proposals, because it's not students' fault, it's their trainers, their teachers, their advisors, who themselves were not fully were trained in those procedures. So that's how my interest was there. Then I learned about this Apna Merit Conference in earlier in March, was held in Islamabad, Rawalpindi. I kept track of it online. I got more interested. Then I attended the webinar 1, where a lot of Pakistani universities leadership discussed their agendas to improve the education system, and particularly the undergraduate education development, the education of nurses, and the reform agenda. And I really thought there is a lot of room for improvement in those areas, particularly from social science perspectives, because social sciences like sociology, anthropology, and other areas, psychology, they don't get very much good status as compared to the loud speaking statuses of physicians and doctors particularly in health field. So what I think I can bring to the table is the concept of sociology of healthcare and medical sociology. Because Dr. Danish Bhatti just mentioned earlier in this program that the more research they do and the more funds you get, and how NIH Islamabad manages those, that's another social variable of medical organizations that needs to be addressed. Contrary to what is the sociology of healthcare, we have two sides on this, because society, disease and illness has an integral relationship with society. In healthcare, physicians are the medical system is the service providers, patients or clients who exist in the context of family, context of community, they are the recipients of services. So if there is a gap, it's not about communication, about interaction, language, it's the cultural understanding of how those social constructs are understood by the medical personnel, health care providers, and how the particular community in society defines those. So when there is not correspondence, there is not good interaction, any services that are delivered, no matter how expensive, how competent is the service providers, they are not going to get a very effective outcome. So I feel that there is a lot of room to incorporate in the curriculums the social science contents from the cultural competency point of view, particularly like gender differences, rural-urban differences, provincial differences. What is it that certain areas are getting a good healthcare and others are not? We all know that majority of Pakistan's population live under underprivileged, deprived conditions, and their access to healthcare is not the same as it is in the other groups of population. So that brings me to the point of accessibility, availability, and affordability, and from the client side. So those accessibility variables, those affordability variables, availability variables, they are plenty. There is a range of it, from emotional cost to financial cost to practice in the context of family. You can give the best medicine, best prescription, but what the patient does with that when he or she walks out of your office.
Well, thank you, Khalid. I think we will obviously, that's where in the game, so that you can look, we can also look into the ethics and from the other side, from the patient point of view, other than our own ideas. So
exactly. And it's globally changing, it's globally evolving. Like when I said society impacts the medical practice and that impacts the society, you can, all of us are now located in the, we are all located in the pandemic era. Nobody knew how it would impact us, but I'm sure many of you are feeling the pinch of it. Some of our faculty members here are losing their jobs. So it's a disease, spread of disease, which is causing this, but then how society is responding to this, that's what is causing that too. So we are in a very difficult and challenging time. I think we need to do the assessment studies in specific areas within your areas. So I'm looking forward to this challenge with you. Thank you for giving me the opportunity.
Thank you, Aisha. This is a different way of looking things, which usually we doctors don't know, or we don't. So it's very important that you're with the team. So Atiya, maybe we go to Aisha now.
Yes, next is Aisha Nazuk, if I say your name right.
Go ahead, Aisha. You got 3 to 4 minutes.
Okay, so I would like to share my screen first.
That would be great.
Yeah, so can you see my screen now?
Yes,
we can.
Okay, so this is Aisha Nazuk here. A very brief introduction. I have a PhD in statistics, and these are my contact details. And I'm very humbled to be included in this esteemed panel of renowned doctors and researchers. If you're interested to know more about me, just a second, my slide, yeah. So this is my Google Scholar profile. I've published on contemporary issues. For example, my PhD was on accountability of non-governmental organization or the NGOs. I've also worked on, the optimality of the so-called Iran-Pakistan-India gas pipeline, which later did not turn into a reality due to the geopolitics. I worked on the accountability of media and some other topics as well. So this is a little bit about me. Now I'll be jumping straight to what is more important regarding today's seminar. One of the important points, because many panelists, they were discussing about the importance of research. I think there is a point to ponder for all of us, that are we valuing our own research or not? I mean, we had a guest speaker at Nash University, because I'm a faculty member at Nash University, so we hosted a seminar there, and one of the professors from Belgium, he very rightly pointed out that, why don't you publish your own studies on in your local journals? And we were like, we know we want to publish in the local journal, but Higher Education Commission somehow is, I won't be using some unfair adjectives, but quite brutal with the local journals. I mean, many of the local journals, they are not even recognized. So if the stakeholder is the local population, I'm not saying that the local population is not reading the international journals, but if the stakeholder is the local population and we are not valuing our own local journals, then who else is going to value those journals? So this is, I think, something rather than a question or a point to ponder, rather than something that I would to drag the discussion on. Okay, regarding the COVID-19 crisis, which has struck all of us, I won't go into the details, but this is a deep knowledge group. It's a private international research group that has ranked different countries, their preparedness on COVID-19. So I won't discuss what are their criterion, because there's a long list of things that they analyze. But if you could see the Pakistan score, it's 370, whereas the maximum could be 740. So I'm not saying that all is the fault of research, but we can get good score if we have good information dissemination as well. Performance is one thing, and dissemination of that performance indicators is also an important aspect. Okay. So, but the government of Pakistan, I won't say, of course, it's not totally blind to the challenge. We have the ministry website where some COVID-19 related stats are available. And out of my own interest, I was also exploring the website of NIH, and I saw very good awareness material is posted there. And it's quite updated. So that was something positive news, because generally we keep on talking about negative things about Pakistan. So it's not all a negative tale. Okay, so I am an active user of this COVID-19 tracking app in Pakistan. I want to highlight this, maybe with the help of this seminar. This statement I'm not giving as a researcher. You can say I'm just talking a common citizen, right? I use this app quite often, and we do have a COVID-19 patient in our neighborhood, right? But this app was constantly telling me that I am in the safe zone. So that was something, there's a glitch in the app. So I think this app also needs, some updation. Okay, regarding the data sources or the medical health sciences related data that we keep on using, given the fact that all the panelists and the people who are listening are quite much aware or more, educated and aware of the matter, because I'm a statistician and I've recently pursued in the domain of health sciences, research in the health sciences. So recently, when I was interacting with some of the people in Pakistan, we have I could say, a bad habit of, putting everything in the basket of conspiracy theories. People believe that COVID-19 is something to do with conspiracy theories like population control, and there are very fancy stories that you have your mouth agape that what sort of things are they discussing. So whatever statistical models of prediction that we are using, for example, if I'm predicting how many people are going to take the precautionary measure, I also need to introduce unconventional parameters like what % of Pakistani population believe in conspiracy theories. Because if they do believe in conspiracy theories, no matter how much you educate them about the health-related aspect of the COVID-19, they will keep on saying, oh, this is nothing, we'll be safe. So we need to introduce some unconventional parameters in the future model that we develop for COVID-19, or so to say for any other disease. Regarding some positivity, that we also have the Pakistani indigenous local kit has been approved by DRIP. And by the way, this was a work of some of the faculty members and students at Nast University. So I'm very proud to be a part of this university that has done, or wake up to the challenge of COVID-19 and producing indigenous technologies. There are a few global challenges, not only pertinent to COVID-19, but as if you have seen, this was something talk of the town, like of the news, that the Lancet has retracted one of the key research publications on COVID-19 because the data used in it was, I won't say fraud, but at least questionable. So there's a need to how to nip the evil in the bud, and how to introduce transparent policies both at a Pakistan level, at an international level. And there are even people are pointing out issues in the global COVID-19 data as well. Like, I won't discuss and go in all these details, but people are comparing how safe is one zone in regard to COVID-19 as compared to other. So there are some hotspots that are being ranked as more safer than areas where COVID-19 is not that much prevalent, but it is ranked that it's less safer to go there. So there are issues in global data as well. Regarding the treatment, it's good news that we have followed the plasma therapy, but the bad side of it is that we heard tale of black market deals of plasma, and some I won't say a word of the mouth because I haven't seen anything published on it, but there were news on the media that there were people who were sort of, selling fake plasma, which is so bad to hear. So, and then an important aspect is that the healthcare service providers themselves, they are at risk. More than 170 healthcare service providers in Pakistan, they have been infected by this deadly disease. Okay. I think I'll skip this part and I'll come to this important, and in advance, I would like to apologize if some of the word choice is not quite welcoming for some of the listeners or the stakeholders in this event. But there's a wise saying that there's a watchdog, but who will watch the watchdog? So if you talk about DRAP, DRAP also needs to look at the different scandals which are tarnishing the image of DRAP. So recently, tax exemptions were given to some selected companies regarding the COVID-19 medicine. So there is a transparency and there's a trust deficit on DRAP that need to be addressed as well. Regarding the IRBs, I'm a part of university, but honestly, I would like to say that very few faculty member or even the senior one, they are aware of this, from which regulatory framework or the research protocols need to be followed. And the member of the IRB, for example, if Dean of the School of Social Sciences or any school is a member of the IRB and he is, for example, an economist or a sociologist, what would he know about clinical research? So that's a big question that we formulate IRBs, but we need to also see whether the people or the member included in those IRB are trained enough to evaluate the specialist research protocols or the proposals that are being submitted to those IRBs. So I won't drag the discussion. This was, we have some other slides as well, but yes, one important point, that there is an issue of conflict of interest in the IRB as well. For example, if I am a member of the IRB and one of the faculty member comes up and he says, Dr. Aisha, I have a very nice proposal. I'll say, okay, you're going to, if we win this project, we are going to bring money to the university. So, okay, there are some things that are out of my understanding, but I'm not consulting any other medical field related expert, but I'll sign it because, and in many cases, interestingly, there are some unconventional things in this framework as well. That is, for example, 2 days before the deadline, the faculty member comes up to your office and say that I have a nice proposal. And you'll say, okay, fine, it's going to give a good image to the organization. So let's sign it. So these are some, glitching or some areas we need to work on. So thank you, and that's about it.
So I think, Atiya, we have listened to everybody in this short time. I would like Waqar, if he's still there, Waqar from Qatar. He's head of psychiatry and a professor of psychiatry who has done a lot of work for Merit in past. If he's there, say a few words. If not, then I think, Atiya, if you want to take one or two questions from the audience and let panelists answer.
Okay, I just want to know if Dr. Bhatti or Dr. Rafiq wants to answer all the questions, because most of the panelists has already answered questions, but they started with the introduction. If not, then I'll move to questions. Is that okay, Dr. Bhatti and Dr.
Yeah,
Rafiq?
that's
I'll
fine.
leave it to Danish, Bhatti, and Atiya, you to and Babar's team to answer those.
Okay. Okay.
If there are a few important questions to take on, maybe we can put them together, lump them together, and then we can take a stab at them.
Sure.
So I will start with the one, let's see. For Dr. Umar, kindly elaborate about clinical research lab. Why is it important to establish such a lab?
You're muted, Dr. Umar.
Now you can hear me?
Yeah.
Yes.
Yeah. Yeah.
Okay, thank you. I think that's a very important question. So the basic issue is of any country or any institution or any group who want to do the research is the infrastructure. You know, the research is not kite flying. It is not done in the space unless you are in the space research lab. So in institution, if there is no lab, there are three types of research. One is the basic research, like PhD in basic sciences or other things. Then you have a clinical research, and then you have a community research. For clinical research, the only available labs are the hospital labs. You can well imagine that one of my lab only do 0.3 million urine tests, and that open at 8 a.m. and close at 2 p.m. And then you only have the emergency lab to do the emergency tests. This is our infrastructure to do the research for undergraduate, postgraduate, and faculty in Rawalpindi Medical University. And same is true in whole of the country in public sector as well as in the private sector. If you do not have a dedicated research lab, a research lab has its own definition, own IT-based system, own building, own equipment, own faculty, own residences, own pay scale, own career system, you know. So then you can't do the research. Then you only have the, what General Ikram said, then statistical research or database research, very simple parameters. So that's unfortunate end of that story, that neither there is a research lab at the national level, neither you have at the institution level. So that's a university, Rawalpindi Medical University as a PC1 with the HEC and the Punjab government to have a research, clinical research lab, which include the 11 sub-component of the clinical labs, which is 1.4 billion, including faculty training and faculty placement. So that's the answer to your question, what I mean by the clinical research lab.
Atiya, go ahead, please. Next one.
Dr. Atiya, this is Dr. Amir. Just briefly, because I've been going through all the questions, I would like to reply. The picture is not that grim, I think. With your passion, your contribution, we are sitting here as we will make sure that all these concerns should be addressed, and we've come up to a level where we are compatible with international. And I would request, I mean, like talking of National Bioethics Committee, it does exist. It with the Pakistan Health Research Council, yes. It is monitoring all the activities, because I just looked after for a few months, and because of the COVID crisis, I totally then diverted toward the NI side. There are bodies in the country which look after all these issues. There's one mentioning that the bioethics masters, basically it was started by Sindh Institute of Urology and Transplant, SIUT. And then all the academic institutes now do have IRBs and institutional biosafety committees. The processes are being followed. Regarding one of the things that the journals, definitely HSE has set up certain standards. So one has to come up those standards before your journal gets that grading. It starts from W to Z, and you have to come up to that level and performance before you come, because I think very rightly initially talked about the Bhattisa by the impact factor and age factors. I mean, we have to be compatible to the international standard. Thank you. That's all from my side.
Thank you, Amit. Thank you. Thank you. Atiya, who's take another question, few more.
Yes, so there were multiple questions, but as Dr. Amir said that he answered most of them, so I'm just gonna go with the ones which are left. So there is a comment by Mariam. No new research are being conducted using the electronic and telehealth. This is great news for Pakistan. Let us use this opportunity to get Pakistan on board. A good example in cardiology is the Apple Watch study, where the AFib rhythm app on regular app watch is being used. Our younger generation in Pakistan can make apps, have it adapted for research and make money.
Yeah, so I like to comment on that. I think that's why we even have some representation from NUST. I have visited NUST labs, like their biotechnology labs, and they're doing some very interesting work. So I think some research is difficult to do in Pakistan, but I believe this like biotechnology or digital research we can do, because there are software writers and there are little hardware makers in NUST and other facilities. So I think telehealth, AI, all of that can be started in Pakistan. I think we have the resources, so we'll work on that. Yeah.
Okay, so the next comment, the comments are keep coming, so okay, I'll keep a track. So next comment is by Nigat.
Can I have a comment?
Yes.
Can I say something?
Yes, Umar, yes.
Yeah, I think look at the very simple things we can do, you know, national database of the diseases, maybe the top 10 diseases. And if we have a national database of top 10 diseases, even one student sitting anywhere can enter into database and can do the whatever research can, at whatever level he wants. Similarly, the university database. So every medical university, can be asked by the HEC to have the clinical database. And that database of that particular disease can be used for the basic research. Rawalpindi Medical University have a database for 2 diseases, one for the dengue and other is the hepatitis C, which is about 20,000 each. So this is one of the small model which can be used to start the research.
That's a good comment, but I think our hope today was just like really kind of getting not even appetizer like a breakfast tea about research. But I think we will involve obviously King Edward and Daw and Aga Khan and everybody else. Like Umar was available. Thank you that he was able to guide us. But I think we'll move in that direction. But this is just a sort of a brainstorming. So one more question, Atiya, we can take. And
can I make a comment, Babar Bhai? So I think this is just like you said, it's kind of a startup meeting, a first principles meeting, and we probably need separate meetings for various aspects of research focused on a particular aspect. And I really enjoyed listening to comments from General Amir and Professor Umar. They really have a good grasp of the infrastructure needs and structural elements. But if I may step back again to the first principle, the core issues, I think one of the core issue is term of research productivity that I see from my personal interaction in Pakistan is the lack of culture incentives and financial incentives. So culture incentives is the peer pressure that you should publish, you should specialize in a special focus. And that's not there because in Pakistan, there is still a lot of value placed on being a generalist, knowing everything, a little bit about everything, सारे scale पता होने चाहिए, सारी information होनी चाहिए, test भी उसी तरह होते हैं, आपकी assessment भी इस तरह ही होती है. Here, when I transitioned to working in America, nobody was reading textbook to hoti nahi thi kisi ke paas. We read papers, we read articles, we read what's latest published, and nobody was supposed to know everything about their topic, but only the niches or on specific areas about their topic. And that culture doesn't exist in Pakistan. And then even bigger problem is financial incentive. Where do you go to apply grants for? How do you get supported for doing a funding? How do you get your salary covered by doing non-clinical work? And Pakistan mein, I think one biggest gap jo America mein big source है research funding का, वो industry है. There is industry partnerships, there is sponsoring of funding and grants that come in directly. पाकिस्तान में पूरा burden government पर डाला हुआ है, HEC पर डाला हुआ है, या government पर डाला कि जी आप fund करेंगे 100% research, जबकि ऐसा नहीं होना चाहिए. यहाँ पे अमेरिका में 70% of research or more is sponsored by industry and pharma, by having those incentives के जी वो बाद में market में product आएगा and it will make money and they will continue the research or will become the source of food into further research in future. And the last thing is the centralization process. जो हम पाकिस्तान में national word बड़ा पसंद करते हैं, तो हम national registries और national organizations और national bodies की बात करते हैं, जबकि अमेरिका में अक्सर जो projects हैं जैसे कि registries की बात हो रही है वो decentralized है. पार्किंसन की रिसर्च जो रजिस्ट्री है वो पार्किंसन की सोसाइटी चलाती है, हैज नथिंग टू डू विद गवर्नमेंट, हैज डज नथिंग टू डू विद अ सेंट्रल बॉडी और नेशनल बॉडी. इट इज डन बाय इंडिविजुअल ऑर्गेनाइजेशंस हु आर रनिंग देयर ओन registries and projects and research projects. Thank you.
Thank you, Danish. I think Atiya, unless somebody have a burning comment, we'll take it. Otherwise, the plan is that over next few weeks, you will get emails from me and Atiya and Danish and all of us. And then idea is to keep talking, fine tuning what we want to do. And then, as I said in the email, sometime in winter, maybe a physical meeting or an online meeting to sort of then come up with actionable items which may be applicable in Pakistan, as Danish and Shahid and us, we did on family medicine recently, and we are on our way to train people in that. So with that, I think I thank you, everybody. Khalda wants to say something, but otherwise, thank you from my side. Go ahead, Khalda.
Just one sentence that in Pakistan, this came to my mind on Aisha's presentation, that how IRB procedure looked at her research proposal. In Pakistan, the culture of collegiality also is lacking. What do I mean by that is that in a department, in the community of researchers, people don't share and interact and have a dialogue on regular basis on what research they are doing, and they don't share those. They don't like to get the feedback from others. They look at it as a criticism. So even positive feedback is lost into that criticism. So people hide a lot of things in their research areas. And I think that's where your ethics building and culture building comes in, which is lacking in Pakistani universities. Thank you.
Babar, I didn't mean to be my word, the last word, but just impression overall from the meeting and the listeners who attended this meeting. I do not want anybody to take this as, because we are Pakistan, we are Pakistani origin, or we are outside Pakistan, but our heart is in Pakistan. It should not be seen as in any way Pakistan culture bashing or Pakistan research culture. I think they are doing a great job with the resources that they have. I think people like General Ikram and Mustapha Qadri and Professor Umar and Mubin, I think they're doing a wonderful job. We have seen that personally. You have seen that as merit team. Danish has seen that. Excellent work by all the physicians and leader there. I think whatever is lacking, that is what this meeting is about. We can do it. So I think I would like to leave it as at a very optimistic note.
So no, I think thank you. Like I have to come back in. So me actually and Shahid, there is politics everywhere. So Apna has politics too. But somehow me and Shahid and Apna Merit has survived all presidents from this side or that side. And we always find a way or finagle a way to continue to work. So our specialty may not be research, but our specialty is whatever the situation is Pakistan, whatever help they need from us, we'll figure out a way to get it done. But we are not like into any like, they are not doing well or right, because Merit really have society in Apna, the only society for last 20 years, which keeps going because of Nahid, Shahid, me, and whoever from any side really. So I think we'll figure out a forward. Thank you everybody. And thank you for spending time and giving us time. And we will be shooting a lot of emails.
Thank you very much.
Can I add one or two lines here?
Okay.
Yes,
So this is Aisha Nazuk here. I just want to clarify one thing, that when I was discussing about the IRBs and the proposal event, that was a hypothetical example. It was not that I went somewhere with my proposal. And one good news that NAST, they have the first Pakistan Science Technology Park that is being started here in NAST. And just last comment, I'm a professor and a female, so pardon if I'm talking more. But the thing is, because we are, projecting, and there are many audience here who are listening to it, that in one of my recent research, I was analyzing the websites of private and public hospitals in Pakistan, and there was some very important and key content that was missing. For example, in some of the hospitals' website, there was not even a list of doctors available on that website, the visiting hours, and what sort of lab facilities they have. So I have different parameters. So there is, from this platform, I would also like to highlight that maybe we need to work on information dissemination in a much better way.
Thank you, everybody. I think this is a very interesting first discussion, but obviously we are nowhere close to anything, but we will continue to move forward. And I think by next year, we should have some good, applicable items. Thank you. Thank you, everybody.
Thank you so much, everyone. We have 10 more comments or questions, but we can check on the panelist list. But thank you so much for